Sir, there was a recent incident where you played a pivotal role in saving a life during a heart attack on Air India flight while you were returning from Tokyo. Could you share the details of that incident and your thoughts and emotions surrounding the experience?
Yeah, sure. I would like to share with you. But before that, I will share another incident. Like in the beginning of my career,
हाँ जी, हाँ जी.
I was just newly appointed assistant professor in PGI, and there was a patient who was a young boy who was a student. He was stabbed, and he
Mhm.
was stabbed in the upper part of the abdomen and profusely bleeding. And he came in the PGI emergency, and at that time, it was vacation period, and my seniors, they were all on vacation, and I was just fresh assistant professor there. And patient needed immediate surgery, but we were not sure whether it had hit the liver or it had hit the aorta, which is the big vessel, or whether it has gone upwards towards the heart. So we just wheeled the patient to the CT room and took a few cuts after giving the dye. And the only thing we could see was that there was air in the pericardium, like in the bag in which the heart lies. So there was air inside. That means the pericardium had been breached. And then I took the patient to the operation theater, and we opened the chest, and we did the repair. There was a injury, stab had gone into the right ventricle. So at that time, if you had to do heart surgery, all the surgeries were being done on pump, and for that we had to arrange the um, all the material that was required to put a patient on pump. But as the student was brought by the other students, and there was no way like we could arrange all the things required at immediate notice. So we just took the risk of taking the patient into the OT, and I did the surgery on beating heart, and the patient revived, and patient went home. So that was one incidence which encouraged me to take initiative and do things which normally people are not doing. So we had to think out of the box when such a situation arises, and we have to use your own innovation how to move forward. So similarly, like in this, uh, after that, many times like patient they crash and we revive them. We do open cardiac massage, and we take them for surgery and do the surgery, and the patient goes home after 5 6 days. So that has become quite common nowadays. And in this recent incidents, I boarded a flight on my way back from Tokyo, where I organized the 12th Cardiomulsion Global Conference. And the flight started at 11:30, and at 2 o'clock there was an announcement that patient is not well. So
Right.
I rushed to help them, and we saw that patient was having chest pain and sweating, and the history that patient was diabetic also. He had a recent COVID infection also, and suspecting a heart attack. Then we gave him sorbitrate tablet, which was available on the flight, and uh, within few minutes, patient crashed, and immediately we put him on the floor of the aircraft and started cardiac massage. And he was pulseless, and there was no respiration. And we kept on doing the cardiac massage, and luckily we were able to revive him. And after that, like we checked from the crew that we were over the sea, and nearest land was either China, or for reaching India it would have taken 5 hours to reach Calcutta. The flight had to be diverted, so I took the decision to divert it to Calcutta, because I was not sure whether I could arrange quickly the angioplasty for this patient there. So I prefer to go to Calcutta, although it would have taken 2 3 hours more. But we tried to keep the patient stable all that time. Then we reached Calcutta. He was immediately, the ambulance was ready, and we shifted the patient to nearby cardiac center, and angiography was done, and LED artery, which was left anterior descending artery, which was totally 100% occluded, was opened up, and patient survived. So it was a really like challenging experience, and with the help of the aircraft crew and the captain, we were able to save the life of the patient.
Wonderful, wonderful.
मैं दिनेश कुमार भरतिया आपको एक सच्ची घटना बताता हूँ। लास्ट मंथ 26 मई को मैं टोक्यो से कल इंडिया वापस आ रहा था। मेरी जर्नी टोक्यो से दिल्ली, दिल्ली से कलकत्ता की थी। सुबह 11 बजे एयर इंडिया की फ़्लाइट में मैं उड़ा AI 307 में। मुझे नहीं मालूम था मेरे साथ इतनी बड़ी घटना होने वाली है। फ्लाइट करीब 1 घंटे उड़ने के बाद ब्रेकफास्ट चालू हुआ। मैंने ब्रेकफास्ट किया, हल्का ब्रेकफास्ट किया था। तो मुझे कुछ फीलिंग्स हुई कि मेरे को कुछ पेन हो रहा है। मैंने उतना ध्यान नहीं दिया। मैंने एयर होस्टेस मिस तानिया शर्मा से कहा कि ऐसे ऐसे थोड़ा पेन हो रहा है, तो उन्होंने एक डाइजिन टेबलेट ला के दी, वो मैं लिया। उसके बाद भी मेरे को आराम नहीं हुआ। फिर लंच टाइम हो गया, लंच देने आई तो मैंने कहा मैं लंच नहीं कर पाऊँगा, कारण मेरे को पेन हो रहा है। तो उन्होंने कहा थोड़ी देर में मैं ये काम सल्टा के आती हूँ। वो वापस पीछे जब काम सल्टा के गई, मैं भी उनके पीछे पीछे वहाँ पेंट्री कार के पास चला गया। मैंने उनको बताया कि ऐसे ऐसे मेरे चेस्ट में बहुत पेन हो रहा है। तो उन्होंने अपनी सीट पर मुझे बिठाया और तुरंत उन्होंने फ्लाइट में अनाउंस की कि कोई डॉक्टर हो तो तुरंत पीछे में आए, एक पैसेंजर इल हो गया है। पता नहीं वहाँ पर डॉक्टर वो जो मौजूद थे, डॉक्टर दीपक पुरी, तुरंत उन्होंने अनाउंसमेंट सुना और वो सामने बैठे हुए थे। तुरंत वो पीछे आ गए मेरे पास। उन्होंने मेरे से पूछा क्या हुआ, कैसे क्या। मैंने बताया ऐसे ऐसे पेन हो रहा है, बहुत जोर पेन बढ़ते जा रहा है। तो उन्होंने एक सर्बिट्रेट की टेबलेट जो एयर होस्टेस के पास थी, तानिया जी ने निकाल के दी, मैंने ली उनकी। फिर उन्होंने पूछा पहले कभी भी कुछ हुआ था? मैंने बोला कभी भी कुछ नहीं हुआ, ये फर्स्ट टाइम मेरे को ये फीलिंग्स हो रही है और इतना पेन हो रहा है। बोला दिस इज़ द साइड इफ़ेक्ट ऑफ कोविड। आपको कोविड हुआ था? मैंने बोला हाँ, 20 में मेरे को कोविड हुआ था। बोला दिस इज़ द साइड इफ़ेक्ट ऑफ कोविड। बात करते करते डॉक्टर साहब से मैं कलप्स हो गया। उसके बाद क्या हुआ मेरे को नहीं मालूम, कुछ भी नहीं मालूम। जब होश आया तो देखा मैं फ्लोर पर पड़ा हुआ था लंबा। मेरे को फ्लोर पर वो लोग सोए हुए लिटा के रखे हुए थे। होश आने के बाद करीब 7 मिनट बाद होश आया मुझे। डॉक्टर साहब ने बताया कि दिनेश तुम 5 मिनट्स कम्प्लीटली डेड पड़े हुए थे। उन्होंने CPR वगैरह समथिंग कुछ किया और माउथ हवा दी मेरे को। उसके बाद उन्होंने मेरी जान बचाई उस फ्लाइट में। अगर वो डॉक्टर साहब नहीं होते तो मेरी लाइफ किसी कीमत पर नहीं बच सकती थी। मैं वहीं एक बार तो मेरे जब मन में आ गया था कि मैं जिंदा धरती पर नहीं जा पाऊँगा। डॉक्टर साहब ने फिर पीछे की सीट थी खाली करवा करके मुझे पूरा सुला करके कलकत्ता तक। उन्होंने मेरे से पूछा कहाँ जाओगे? मैं बोला मेरे को कलकत्ता जाना है, लेकिन फ़्लाइट भैया दिल्ली है, दिल्ली से फिर कलकत्ता जाना है। तो उन्होंने तुरंत पायलट से बात करके फ़्लाइट को डाइवर्ट किया कलकत्ते के लिए और कलकत्ता मेरे को 3 बजे लैंडिंग करवा दिया। लैंडिंग करवाते ही और इसी बीच उन्होंने पूरी फ़्लाइट में 5 घंटे की जर्नी और बाकी थी जब मेरे को अटैक आया। 2 घंटे की जर्नी हम लोग फ्लाइट में कर चुके थे और 5 घंटे की बाकी थी। तो उन्होंने मेरे को हर मतलब वो ऑक्सीजन सिलेंडर लगा के रखा कि कोई तकलीफ़ नहीं हो और पल्स और BP मेरी हर घंटे वो चेक कर रहे थे। रियली ही इज़ द गॉड। डॉक्टर दीपक पुरी, तानिया शर्मा एंड जावेद, ऑल सब क्रू मेंबर्स, मैं उन लोगों का ज़िंदगी भर आभारी रहूँगा जिन्होंने इतनी बढ़िया से मेरी सेवा की फ्लाइट में। फिर कलकत्ता लैंड होने के बाद मुझे तुरंत वहाँ पर इन लोगों ने पहले से ही ATC द्वारा कलकत्ते को इन्फॉर्म कर दिया था, मेरे रिलेटिव सबको इन्फॉर्म कर दिया था। सारे रिलेटिव एयरपोर्ट पर मेरी प्रतीक्षा कर रहे थे। लैंड करते ही इन्होंने एम्बुलेंस से मेरे को आमरी हॉस्पिटल ले गए। वहाँ पर सारी व्यवस्था की हुई थी, डॉक्टर सब पहले से ही मौजूद थे। तुरंत मेरा सब चेकअप वगैरह देखने के बाद उन्होंने कहा कि इनकी एक आर्टरी पूरी 100% ब्लॉक्ड हो रखी है, वो तुरंत इनको एंजियोग्राफी वगैरह करना पड़ेगा। तो डॉक्टर साहब ने वो मेरे को वो एक स्टंट लगा दिए और नॉर्मल हो गया। एक दिन हॉस्पिटल में ऑब्जर्वेशन में रख के सेकेंड डे फिर थर्ड डे मेरे को छुट्टी दे दी। मैं घर पर अभी रेस्ट कर रहा हूँ। डॉक्टर साहब ने बोला था अब तुम नॉर्मल हो, आराम से काम पे जा सकते हो, कोई दिक्कत नहीं है, बट थोड़ी सावधानी रखना। ये रियली बता रहा हूँ। अच्छा, सेकेंड, डॉक्टर साहब ने एक चीज़ बहुत अच्छी बात कही है, डॉक्टर दीपक पुरी, हर आदमी को सीपीआर की ट्रेनिंग लेनी चाहिए, बहुत ज़रूरी है। उन्होंने कहा फ्लाइट में हर साल हजारों लोग ये हार्ट अटैक से मरते हैं, किसी को कोई जानकारी नहीं होती है। और कभी भी आपको फ्लाइट में कुछ भी जरा सा पेन कुछ भी महसूस हो, तुरंत आप क्रू मेंबर को इन्फॉर्म कीजिए। ये नहीं कि सीट पर बैठे हैं कि गैस का पेन है या समथिंग पेन है, डोंट, उसके लिए कभी भी मत हिचकिचाइए, तुरंत क्रू मेंबर को फ़ोन कीजिए, बताइए कि ऐसी ऐसी प्रॉब्लम। अदरवाइज आप सीट पर ही सोए रह जाएंगे, बगल वाले पैसेंजर को भी नहीं मालूम पड़ेगा कि आपके साथ इतना बड़ा हादसा हो गया है। मैं तो डॉक्टर साहब का जिंदगी भर के लिए आभारी हूँ।
Dr. Puri, as a highly esteemed cardiac surgeon, your expertise is definitely invaluable, especially in critical situations. What would you advise to a common man if he or she they experience a heart attack or somebody else is experiencing? What actions you would recommend to provide immediate assistance and potentially if life can be saved?
The most important thing is time, because whenever your artery is blocked, your muscle of the heart is not getting the blood supply. So every minute is crucial, and every minute of delay will reduce the number of years you are going to live later on. So first hour is very crucial, known as the golden hour. And most of the people, what mistake they do is that they like they think that this is not a heart attack, this is maybe indigestion or some gas problem, and they start taking antacids, and they start taking like local remedies. And because of this there is a delay in the patient reaching the hospital and seeking treatment. So if the patient doesn't reach the hospital within 1 hour, and if the artery is not opened up immediately, the muscle will start dying. So if the artery is not opened up within 6 to 8 hours, then there will be a permanent damage. And even if the patient is saved because of the aggressive treatment later on, this patient will remain a patient of heart failure for the rest of his life, because some part of the muscle will be already dead. So most crucial thing is that whenever there is any pain or discomfort above the level of umbilicus, even in young patient nowadays, we should keep the first possibility of heart attack.
Okay.
And once the heart attack is ruled out, then only you should treat it as a muscular pain or maybe acidity or anything else. But first we have to be very sure this is not a heart attack.
Okay.
Because many patients, they may even not have the classical symptoms. Some patient may just have sweating, some patient may have just some discomfort in the upper part of abdomen, and many patients may be just having a feeling of like uneasiness or some compression in the chest. Some patient may have pain in the upper part of neck or jaw, or maybe shoulder, or maybe arm. And especially women, they don't have classical symptoms. They may just feel a little weak, and there may be some sweating, or there may be a headache, and some feeling of being unwell. So most of the patient, we must understand that the diabetics and female population, they usually don't have classical symptoms, and almost half of the men also, they don't have classical symptoms. So first we have to rule out heart attack and get immediate attention, go to a hospital, which has cardiac facilities, and get ourselves evaluated. But if cardiac facility is not available nearby, then we have the option of getting thrombolized. So some medicine is injected into the blood, which can dissolve the clot. So after that, uh, we gain a few more hours and little more time so that the patient can be safely shifted to the nearest place where the cardiac facility is available. So the most common mistake that people do is they go late or they shift a patient even if the nearest cardiac hospital is several hours away. So some patients they die on the way. So both the things they are not to be done. And if we take proper care and if we get treatment well in time, and then most of the patients can be salvaged and we can have a normal heart function even after a massive heart attack. And above all, 80% of these heart attacks they are preventable by simple steps. So everybody should adopt preventive measures first.
Definitely. Right, sir. Sir, we sincerely appreciate your visionary leadership, commitment to research and education, and relentless pursuit of advancements in cardiac care. Your contributions to the medical community and life saving interventions, such as the recent intervention during a heart attack on flight, demonstrate your unwavering dedication to the betterment of patient lives. Once again, our warmest thanks for sharing your expertise, passion, and experiences with us today. We are honored to have had this opportunity to learn from you today. We wish you continued success in all your future endeavors and look forward to witnessing your continued impact on the field of cardiac sciences. Thank you, Dr. Deepak Puri, for being an extraordinary healer and a true inspiration. And thank you, sir, for
Thank
being.
you very much for being so motivating. And definitely we will try to do our best in future also. And we would like to give the best care and best services to all the people all over the globe.
Right. Thank you, sir. Thank you so much.
Thank you.